Hi, my name's Ashley. I'm a nurse practitioner. I was here just to do a head-to-toe physical exam on you today.
Okay,
Good.
sure.
First, I'd just like to ask if you can tell me your name, your date of birth, and why you came in today.
Caitlin Kane, birthday February 9th, 1998. Just for like an annual checkup.
A checkup?
For a while.
Perfect. So how have you been feeling lately?
Yeah. Pretty good. Yeah.
Good? Good, no pain, no complaints or anything that you'd like to address?
No.
Off the bat. Okay. Well, first I'm going to start with your, we're just going to do some vital signs here.
Okay.
I'm going to have you slip your arm in through here. Perfect. Okay. While I do that, I'm going to throw this on your opposite hand, on your finger there. You can just relax your arm. We have a 118 over 82. Looks like we are sounding 99%. I'm just going to write this down here. Okay. And I'm going to have you stick this under your tongue while I take that blood pressure cuff off. You can hold it if it's comfortable. Okay. Let's see, 98.2. Perfect. And while we are doing this assessment, I am going to just be doing like a generalized skin assessment throughout because I will be looking at various parts of your body throughout the exam. But just generally, you are well appearing, well groomed. Doesn't see any obvious signs or anything notable. And so next, we're going to start with your vision. I'm going to hold this card over here.
Okay.
Would you just be able to read the furthest line down you can for me?
CFDHJ.
Perfect. Can you try the one above it?
EPTZO.
Perfect. Okay, now can you cover your left eye? And can you read the second to last line?
CFDHJ.
Okay, and then swap, cover your other eye. And can you read the lowest line you can?
CFDHJ.
Okay. All right. Now, I'm just going to have you look kind of straight at my nose here. I'm just going to shine a light from either side, okay? Perfect. Good. Okay. Now, I do want you to stare right at this pen. I want you to follow it straight in. Perfect. All right, now I don't want to follow with just your eyes. Good. All right. Next, I want you to puff out your cheeks, wrinkle your forehead. Good. Frown. Perfect. And then we're going to do something here. I'm going to use just this tissue. I'm going to have you close your eyes. When I touch your face, I want you to say yes, okay? This is just touching or feeling for some sensation and things, okay?
Yes. 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 Yes.
Perfect. I also want you to, can you stick out your hands for me? Your palms? Like hands up?
Eyes shut?
Yep, keep your eyes shut.
Okay.
It's going to be the same thing.
Yes. 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 Yes.
Perfect. Okay. And then next, what I'm going to do is I do have a paper clip here. One side is going to be, you can open your eyes just to look at this. One side is going to be sharp and one side is going to be dull. I am going to go and I'm going to tap your hands and I want you to be able to tell me if it's sharp or dull, okay?
Okay.
So I want you to close your eyes, ready?
Dull. Sharp. 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 Dull. Dull. Sharp. Sharp.
Okay. And now we would typically do this for your feet as well, for the sake of the video. We are going to move past that. So next, what I'm going to do is I'm going to come stand over here. I want you to kind of occlude your right ear. And I'm going to whisper a word. I want you to be able to repeat it back for me, okay?
Baseball. Sugar. Football.
Perfect. Now I'm going to do the same thing over here. If you can occlude your left ear this time.
Baseball. Candy. Rockstar.
Perfect. Okay. Now we're going to move on and look at your mouth. I am going to have you open it up wide. Stick out your tongue. Say ah. Perfect. Good. Now what I am going to have you do is I'm just going to test like strength of your accessory muscles here. So I'm going to place my hands on your shoulders. I want you to try to shrug up. Perfect. I'm going to place my hand here. Try to look towards my hand. Turn your head good. And the same way the other side. Good. Showing very good strength throughout. Next what I'm going to have you do is I'm going to have you take your finger to your nose and then out to my finger. So go ahead, touch my finger. Back to your nose. So my finger to your nose. And back. Okay, now can you use the other hand? Finger to nose. Perfect. So now what I'm going to ask you to do, I'm going to have you take the heel of your right foot to the knee of your left and then down to your shin. Perfect. And I would like you to do that on the same on the other side. Okay, now I'm going to have you close your eyes. Stick out your hand and I'm going to hand you a very familiar object. I just want you to be able to tell me what it is. You can feel.
It's a pen.
Perfect. Okay, now give me your other hand. I'm going to draw a number in your palm and I want you to tell me what it is.
A 7.
Yes. Perfect. Okay. Now we're going to move on. We're just going to assess your scalp. Do you have any pain or anything different that you've noticed with your hair? Okay, I am going to start to feel here. Feeling for any bumps, bruises. See any lesions or anything there? Any pain?
No.
No? Perfect. I am going to go through and assess your lymph nodes now. So we're going to start preauricular, postauricular, all the way down. I am feeling if I feel anything hard, swollen. If you have any pain or tenderness, let me know. Anything?
No.
Perfect. So now I'm going to have you kind of turn to the side a little bit. We are going to assess your thyroid gland. So for this, I am going to place my hands on both sides of your neck.
Okay.
I'm going to feel. Okay, I'm going to have you swallow. Perfect. And we do feel it move appropriately. It does feel appropriate in size and nature. Next thing what we're going to do here is I'm going to use my speculum. I'll put a cover on it here. We are going to assess your ears and nose.
Okay.
Okay. So I am going to take your ear. Do you have any pain?
No.
Pressing? I'm going to press right here. Any pain?
No.
It appears normal in color, the same to the rest of the face. No pain or tenderness. I am going to insert this into your ear. Okay, just looking for the perfect. I'll look in the other side as well. Perfect. Okay, now I'm going to have you lean your head back a little bit.
Do I still face this way?
You just face me. Lean your head back. I'm going to touch you here. So now look in your nose. Make sure septum is even, symmetrical on both sides. No obvious abrasions or lesions. Perfect. Now while I have this here, I am going to use my ophthalmoscope. Get this out of here. So look at your eyes. So I am going to be using this. We're going to assess the back of your eye, kind of look at the optic nerve and everything. So I do want you could just pick a point on the wall and stare straight ahead, okay?
Okay.
I'm going to get relatively close. Perfect. I'm going to come around to this side. I'm going to do the same thing. Then I am going to move on to your heart and lungs. So first I'm going to ask you just to lay down. While we are here, we're just going to inspect if the chest wall looks symmetrical, while you're taking deep breaths, there are no lifts, heaves, anything like that. So we are going to start, we are going to palpate your PMI, or your point of maximum impulse, which is typically the fifth intercostal space, mid-clavicular line. You should be able to feel it there. Perfect. Okay, and I can have you sit back up. Now I am going to take a listen. Alright. Just breathe normal. While we are on the cardiovascular, I'm going to assess your pulses. We are going to assess your temporal pulses up here first to begin. You should feel a +2 bounding pulse. Now we're going to assess the carotid. We won't do both at the same time. I'm going to check your radials. Everything we do have +2 pulses in the radial, so we will assume that your pulses higher up are intact as well. Okay. I'm going to check your pedal pulses here. Good. And your legs are warm. Your cap refill is less than 2 seconds. Brisk. You can see your hands as well. Over. And the same for your hands. So now I'm going to have you kind of turn back to the side like I did earlier. Okay. Yes. So we are going to talk about your lungs now. So I am just going to generally assess how you're breathing just to make sure everything appears symmetrical. You are going to feel my hands here just to make sure everything is... Actually, let me turn this way just so the camera can see.
Like all the way around.
Yep, go ahead. Sure. That's perfect. So I'm going to put my hands here. Now, right on either side. Okay, now I want you to take a big deep breath in. And out. Good. One more time. Out. Perfect. So now you are going to feel some tapping. I am going to percuss along the lung fields. And that did reveal tympanic sounds all throughout, which is normal. So now I am going to place the ulnar side of my hands on your back here over your lung fields, and I want you to repeat the phrase. Every time you feel my hands move, I want you to say 99. Okay? Ready? Go ahead.
99. 99. 99. 99. 99.
Perfect. Now I am going to take a listen. Just take a deep breath. Okay. Okay. And I can have you spin around one more time. Just breath. And now listen for your lung sounds from the front as well. So I am going to ask you to lay down one more time. I'm sorry, it's up and down, back and forth. So we are going to move on to the abdomen. First, we just want to note the abdomen is flat. Any bulging, lumps, bumps, nothing like that is out of the ordinary. Have you been having any abdominal issues lately?
No.
No? Okay. Perfectly, we are going to inspect, like I said. Second, I am going to auscultate. We are going to listen for bowel sounds. While I am at your abdomen, I am going to listen to your abdominal aorta and then move out to listen for your renal and iliac blood flow.
Okay.
So we'll start there, and we will be listening for vowel sounds as well. All right, next we are going to percuss again, so you are going to feel that tapping. Okay, we do feel here, I should say, the tympanic sound, which is expected. So now I am going to press down. I am going to start just pressing lightly. If you feel any pain or tenderness, I want you to let me know. Now I am going to press a little bit deeper. Any pain?
No.
Okay, now we are going to assess on both your left and right side, just to see if we can palpate the liver. If it is enlarged, there might be a chance, but if not, it's normal to not be able to feel it. So you're going to feel me. I want you to take a big deep breath in. Okay, breathe out. We're going to do the same thing over here. Deep breath in. Okay, and out. Perfect. Okay, so now what we're going to do, we're going to do your musculoskeletal and your joints. But since you're laying down here, we can just start with your hips because you're going to have to be laying down.
Okay.
So first I want you to be able to raise this right leg, right at the hip. Perfect. And you can put it back down. You can lift up your left. Great. You want to kick your leg out to the side. Great. And then the other way. While this, we're noting that the skin is all intact. There are no abnormalities, lesions, or any kind of issues there. And we'll have you flip over to your stomach. Once you do that, I'm going to ask you to try to take your hip back, like you're up off the bed. Yep, perfect. Okay. And you can do the same with the other one. Good. Now you're able to sit up on the side of the bed. Okay, so what we are going to do, I'm going to start with your hands, kind of go up and then down. So we're going to look at the hands here, inspect all of the joints. If you have any pain or tenderness, let me know. Anything?
No.
Perfect. So I'm going to have you put your hand, lift your wrists up, down, back flat, open your fingers wide, closed, make fists. I'm going to have you put your fist this way. You put your hands up and down. Perfect. Now we're going to go for the elbow. We're going to feel along all of the bony prominences here. Make sure everything feels appropriate. Now for your elbows, I'll have you bring them up and down. And if you're sitting like this, you can go out. Perfect. We will move on to the shoulder, up. You have any pain or any tenderness through your shoulders?
No.
I want you to bring your arms up. Then we're going to supinate and pronate, go out, and you can go all the way up. Perfect. Now we're going to move on to the knees. So I'm going to just palpate here. Good. Can you fully extend your knee and then bring it back up? Perfect. Same with the other. Good. And then we're going to move down to the feet. Any pain? I want you to press your feet against my hands. Good. Pull them up to your nose. It'll give you like a 5 out of 5 strength in those. And then I want you to just kind of roll your ankles, just kind of hit all of the mobility. Perfect. Now lastly, I'm going to have you, can you lean your head forward? Good. Lean your neck back up. Go to the right side, ear to shoulder, ear to other shoulder, and then you can just spin your neck around there. Perfect. I want you to grab my fingers, give them a good squeeze. Perfect. 5 out of 5 strength as well. Now I'm going to ask you to stand up. And I just want you to kind of walk. Can you just walk from here to there for me? Just noticing if your gait is even, steady, balanced, and things like that. You can walk back. Perfect. When you walk again, I want you to walk on your tiptoes.
Okay.
Perfect. And when you come back, walk on your heels. Good. Now turn around. Now I'm going to ask you to like lean forward just a little bit, try to touch your toes. We're going to look at the curvature of the spine, make sure everything is midline. Do you have any pain or tenderness coming down?
No.
Perfect. Now I'm going to have you lean back up. You can kind of lean back a little bit. Good. And even in your normal posture, you do have the appropriate curvature of the spine. So now I do want you to close your eyes. We're going to do this. It's called a Romberg test for about 20 seconds just to see if you are to sway or like lose balance. I am close enough to you. If you were to lean or fall, we can catch you. Okay. Otherwise, I think that kind of concludes everything.
Okay.
Thank you very much. Do you have any questions or anything else you'd like to go over?
No, I think that's all.
Perfect. Thank you so much.
Yes, thank you.